What is vocal cord atrophy and how does it impact the voice? Let's talk about it. Hey everyone, my name is Maurice Goodwin. I'm a speech-language pathologist that specializes in the treatment of voice problems. In my practice, there is probably not a week that goes by that I'm not treating someone that has vocal cord atrophy. Vocal cord atrophy can be pretty simply defined as a weakness or a loss of the muscle mass that make up our vocal cords. Now you can think about your vocal cords maybe a little bit like your arm or your hand. If you were to touch and press on the tissue of your arm and hand, you can feel the fleshy part. Now let's say you got a cast or you had injured your arm and your arm had to go into a cast. Now, a few weeks or a few months later, when they take that cast off, you might notice that, well, your arm is still there, but it looks a little bit smaller or a little bit thinner than your other arm. That process is essentially what happens to your vocal cords when they begin to atrophy. They lose the muscle mass, the fleshy, thick part. The difficult thing about losing muscle mass and thickness of the vocal cords is that when your vocal cords vibrate and come together, we want them to create a complete seal, a complete closure. And you can see an example of that in a video of my vocal cords here. But if those vocal cords don't close completely, what you end up getting is a gap in the vocal cord closure. That gap in the vocal cord closure often results in a breathy voice, a weak voice, and sometimes even a hoarse or a rough voice. Anybody can experience vocal cord atrophy. We most frequently tend to see it in older adult men or older folks with lower voices. And this physiologically makes sense. As older adult men age or folks with lower voices age, their muscle mass tends to get a little bit thinner. They lose muscle mass. And that happens here in the vocal cords as well. But anybody can experience vocal cord atrophy. Some other times when we see vocal cord atrophy is if someone has gone through a significant period of deconditioning, maybe sickness where they weren't using their voice a lot. We can also see atrophy in the setting of a vocal cord paralysis, where the nerve firings to the vocal cord are weakened or absent, so the muscles themselves become weak. Vocal cord atrophy can also result in feelings of strain and effort. Because those vocal cords are no longer closing as tightly as they did before, often the person who's experiencing has to put in a little bit more work to get their voice out. Vocal cord atrophy is diagnosed by an ENT or a laryngologist and can be treated by both that ENT and or a speech-language pathologist. And a speech-language pathologist would be able to do voice therapy with someone who has vocal cord atrophy. Now, full disclosure here, I am a speech pathologist myself, and I tend to think that therapy is pretty beneficial for folks who experience vocal cord atrophy. But really, it depends on the person, maybe how atrophic those vocal cords are. But when applied, considering the many variables at play, voice therapy can improve the experience of someone that has vocal cord atrophy. There are a number of voice exercises that can be applied in this situation, and we in the field are still learning about what exercises produce the best outcome for folks with vocal fold atrophy. Typically, the approach that we take is strengthening the relationship of power, the breath, source, the vocal cords, and filter, our resonance. When we experience a weakness in one part or one subsystem of our voice and speech, sometimes we can rebalance that by putting focus on power and filter to get the voice quality that we want. There's also some early data that using strong voicing or loud voicing can actually improve the strength and coordination of some of the muscles responsible for using your voice. I am not a physician, but physicians can also play a role and often do play a role in the treatment of vocal cord atrophy. Sometimes when the atrophy is too significant or too severe, the gap between the vocal cords is just too wide, therapy maybe isn't helpful or not recommended, the physicians might recommend and perform some form of medialization procedure. And similar to our treatment for vocal cord paralysis or paresis, vocal cord weakness, we can improve the closure of the vocal cords, which is hopefully going to improve the overall quality of the sound. This can happen through injection procedures with various types of materials or something more permanent like a thyroplasty. If you yourself or someone you know is experiencing that weak, breathy, and maybe even strained voice quality that we often associate with vocal cord atrophy, I encourage you to get a full voice evaluation with an ENT and preferably with someone who specializes in voice disorders. They will be able to take a look at your vocal cords and see what's going on. If you have any questions about vocal fold atrophy or the treatment of vocal cord atrophy, feel free to reach out. If you liked what you saw here on the channel, subscribe, like, leave us a comment, and I'm excited to share more about the voice with you. See you later. Bye.